Hello, we are a team of engineers and nephrologists at Johns Hopkins, and over the past month, we have been working to address the shortage of dialysate due to the coronavirus pandemic. By now, I think we all understand that this pandemic has been extremely difficult on our healthcare system. With the virus spreading quickly, hospitals have been burdened by supply shortages of medical equipment, with ventilators and PPE among the most notable of shortages. While most of the focus around coronavirus complications relates to the respiratory system, the virus can also severely compromise the renal system. With an alarming number of ICU patients developing acute kidney injuries, more and more people are in need of emergency dialysis treatment. And while the ventilator and PPE shortages were expected, there really wasn't any preparation done for the increase in kidney patients. The specific type of dialysis used in ICUs requires bags of fluid called dialysate to clean the blood of toxins and excess fluid. However, with the increasing number of kidney patients in the ICUs, many hospital systems are beginning to face dialysate shortages. One system that was hit especially hard by this problem was Columbia, where their daily dialysate need jumped to a level comparable to Hopkins' normal monthly dialysate requirement. When doctors at Columbia realized this problem was coming, they reached out to nephrologists at Hopkins for help. Hopkins didn't have enough dialysate to send to New York, but Dr. Parikh and Dr. Fine had the great idea to just generate dialysate in the hospitals. They found that this could be done using a hemodialysis machine connected to a dialysis filter called a dialyzer. However, for the dialysate to be compatible with the ICU equipment, the dialysate needed to be bagged. This is when Dr. Parikh, one of our clinical mentors this year, reached out to the team of engineers for help. He asked us to develop a simple device that would allow the collection bags to be filled safely and efficiently. We immediately went to work designing an adapter to connect the collection bag to the dialyzer. We wanted this adapter to make this connection without contacting the dialysate so that it would reduce the risk of fluid contamination. Our design was simple, as the adapter is just a linear connector that allows fluid to flow straight from the dialyzer to the collection bag. We reverse engineered the threads on both the dialyzer and the bag to ensure a tight fit, and adjusted the adapter's length to make sure the fluid did not contact the adapter. Fortunately, we had a 3D printer available for our use, and with just a few printing iterations, we had an operational prototype. Less than 24 hours after being contacted by Dr. Parikh, we traveled to the hospital to test it as part of the completed system. To our delight, everything worked perfectly and the bags filled without leaking any dialysate fluid. We realized that we had a really valid solution and began working to prove that the dialysate we were collecting was safe for use.
Our mindset quickly switched from development to validation as we began performing testing on both the dialysate and the adapter. Our goal was to quickly prove the safety and efficacy of the process so that it could be added to the FDA's Emergency Use Authorization, which is an expedited process of clearing medical devices to be used during this pandemic. Fortunately, the FDA was well aware of this pressing issue, and they met with us right away to discuss our testing plan. We performed 2 tests on the dialysate and 3 tests on the adapter. For the dialysate, we performed chemical testing to see if the concentration of analytes in the dialysate changed over time. Our results were successful, and we found that all analytes remained in safe and stable conditions over a 23-hour period. Next, we performed a 2-day microbiology test to determine if any bacteria or endotoxins grew in the dialysate. The results came back with no growth, showing that the dialysate could be collected without any contamination. The next step was to test the adapter. We started by sending the highest possible flow rate of dialysate through the system to ensure that the adapter could withstand this pressure without the dialysate leaking out. Next, we wanted to ensure that the dialysate makes no contact with the adapter, since the adapter is 3D printed and could possibly leach polycarbonate into the dialysate. To test this, we took microscopic images of the interface between the dialyzer and the collection bag. We saw no air gap between this interface, showing that the dialysate makes no contact with the adapter. Finally, we performed 3 cycles of ETO sterilization and measured the critical dimensions of the adapter before and after each cycle to ensure that it did not deform. We are making our process and adapter open source so that any hospital in need can utilize our solution. We have created a document that explains how to 3D print an adapter and how to perform the dialysate generation process. We are currently looking for more avenues to disseminate this document to reach those in need of making dialysate. Since the process and adapter have not yet been added to the EUA, our document also includes our testing protocols that we believe hospitals should perform before clinical use to ensure that the dialysate they're producing is safe. We have modeled this process and testing plan off of the FDA's general guidelines for creating dialysate during this crisis. Additionally, we plan to continue testing so that the process can soon be added to the EUA. Thank you for taking the time to learn about this exciting project. It has been a really rewarding experience to be able to contribute to fighting this pandemic. We have an amazing team of talented nephrologists, our CBID program director, and my fellow engineers and I who have all come together to push this project forward as fast as we can. If you have any questions or suggestions of how to spread the word about our solution, please reach out to us at c19adapter@gmail.com. Thank you, and we hope you stay healthy and safe.